Welcome to today's press briefing. Today our speakers are Dr. Zhuang Shouquan, Head of Communicable Disease Branch of the CHP, and Dr. Larry Lee, Chief Manager of the Hospital Authority. The doctors will tell us about the Hospital Authority situation and the new cases. Dr. Lee, please. Good afternoon. The HA has a total of 2,711 confirmed patients in hospitals. 340 are new patients. For isolation wards, there are 431 in isolation wards, 201 patients in second-tier wards, 588 patients are at AWE, 207 patients are at the North Lantau Infection Center, and 241 are new patients. 8 patients were critical yesterday, 4 with 3 jabs, 3 with 2 jabs, 1 with 0 jabs. 12 patients were in serious condition. Among the inpatients, 54 are in critical conditions, 57 serious. At ICU, there are 12 critical patients. For the disease cases today, there are 11, 8 males and 3 females between 46 and 95 years old. 6 disease patients were not completely jabbed with 3 doses. 1 was from residential care home. For the 11 disease patients, 6 whose staff we believe to have relationship with COVID. For the other 5, they may not be related to COVID. Now, first, 67-year-old a male, no vaccination record, with a cerebral edema. Now, he was admitted to the North Lantau Infection Control Center with a shortness of breath and low oxygen level. He was unconscious. As the A&E, he was intubated, X-ray revealed pneumonia. PCR test revealed him to be positive. His condition continued to worsen. Passed away on the 9th of September. 92-year-old a male with 3 jabs with serious heart disease and renal problems. He was admitted to Prince of Wales Hospital with shortness of breath, a fever, and coughing. RAT and PCR positive. After admission to the hospital, his situation turned for the better at a stage, and then he was transferred to another hospital. However, he later developed complications of heart and pneumonia and passed away on the 10th. The third patient, a 92-year-old male with 3 jabs, hypertension, diabetes, and a pancreas issue. He was admitted to the UCH A&E. His RAT results was positive 1 day ago with fever, low oxygen level, pneumonia, passed away on the 12th. The 4th disease patient, 95-year-old female with 2 jabs, with brain hemorrhaging and dementia record. She was admitted to the Neversole Hospital with fever, PCR positive with pneumonia. She was transferred to the Taipo Hospital for convalescence. However, she passed away on the 16th. The 12th. 80-year-old male with no vaccination record, with hypertension and a stomach ulcer. He was admitted to the Princess Margaret Hospital with shortness of breath and pneumonia and PCR positive. He passed away on the 10th of September. 92-year-old male with 2 jabs with gallbladder stone. He was admitted to Queen Elizabeth Hospital. General condition was bad with coughing. RAT and PCR were both positive. Some 1 week later, he was transferred to the Buddhist Hospital for rehabilitation. However, he developed pneumonia complication and stomach hemorrhaging, and he passed away on the 10th. And also, 4 other disease patients are believed to have indirect link with COVID. 62-year-old male with jabs with serious heart condition and arrhythmic condition. On the 10th of September, he was sent to the Prince of Wales Hospital. He was found to be conscious by his colleague. He received CPR, however, he passed away subsequently. The 8th patient, 46-year-old male with no vaccination, with hypertension, diabetes, and asthma, admitted to the Queen Mary Hospital, PCR positive. His major condition was a heart issue and a large area ischemic stroke, and he passed away on the 11th. 91-year-old male with jabs. He was sent to Tumor Hospital by the AWE. He had a fever. His heart enzyme shot up after admission to hospital. That was also a heart problem, and he passed away on the morning of the 10th. 80-year-old male with 3 jabs, stomach and kidney cancer record. He was admitted to the Queen Mary Hospital. He had a femur fracture, PCR positive, and then because of the high heart enzyme and also another heart condition, he passed away on the afternoon of the 10th. The last deceased patient with unconfirmed reason cause of death, 19-year-old male with 2 jabs. He had atrial fibrillation and also a dementia record. He had coughing, PCR and RAT both positive. On admission, he was unconscious and was in a shock. Intubation and other resuscitation attempts failed, and he passed away. In the past day, 314 patients have recovered, 278 patients have been discharged, 4 patients are found to be positive on admission, 6 patients in the same ward were classified as close contacts. For staff, we have 88 new patients and 188 staff returned to their positions. Now, another report on the cluster in the Kowloon Hospital. On the 9th of September, a 63-year-old male patient was confirmed to be positive. Our investigation found 2 more patients, an 84-year-old male patient and was confirmed, and there are 2 other close contacts. All 3 patients are in isolation in stable condition as well. Now we are finding the links. The ward has suspended receiving new cases and is undergoing thorough disinfection. We will continue to inspect the health condition of our staff and patients. Good afternoon. Yesterday, we had a total of 8,902 cases locally, including 2,236 PCR positive and 6,666 RAT positive cases. Correction, 8,904 cases, 2,236 PCR positive and 6,668 RAT positive. We had 129 imported cases, including 114 cases tested positive on PCR and 15 RAT positive cases. Among the 129 imported cases, 39 were caught at the airport. During hotel quarantine and quarantine centers, there were 40, and also 49 from the 0 to the 7th day in quarantine center, and the 8th to 10th day in 1 case. 4 cases have imported more than 10 cases, including UK. The UK 21, the US 16, the Philippines is 15, Singapore 12, and the other 28 places have imported less than 10 cases. So totally told us about the reports of these deaths. There were 9,586 total deaths during the 5th wave. For care homes, there are 2 care homes reporting outbreak today where residents have to be quarantined. Global Elderly Care Home in Kowloon City, 1 resident confirmed, 6 residents are quarantined. Hang Lam Elderly Care Home at Sam Shui Po, 1 resident confirmed, 2 residents are quarantined. Now today is Sunday, school is closed. Still, 3 schools have reported cases yesterday and today. We have advised them to suspend class for 1 week.
有兩間。
Two of them are in Yunlong. One is the Yunlong Rural Committee School, Secondary School, Class 1B, which has 29 students. 3 of them in the past week tested positive. Yesterday afternoon, we asked them to suspend class for 1 week. And also in Yunlong TMHK Secondary School, 4 tested positive from 1E class, which has 37 students. 4 of them were diagnosed with COVID-19, and so the class has to be suspended for 1 week. In Shusai 1 in Eastern District, Hanwha College, 2C class, which has 40 students, 6 of them tested positive. So we suggested the class should be suspended for 1 week. In terms of the subvariant, in the samples collected on September 8th, BA4, BA5 cases made up 75%, a slight rise, which means that in the community, BA5 cases made up 66.4%, BA.2 make up 20%, BA4 make up 8.6%, and BA 12.1 make up about 5%. So just a slight difference from yesterday's distribution. So now it's the time for questions. Please raise your hand, and before you ask a question, please let us know which media outlet you're from. First one, gentleman in white. Good afternoon, I'm from Now TV. I'd like to ask the HA about the ward for pulmonary disease. Is it that 2 patients tested positive? What are the ages? And also, in the death case, there's one from residential care home who was transferred from Asia World Expo to Tuen Mun Hospital. Could you describe to us how his situation deteriorated before he was transported to hospital? And also the trend of the cases, now it dropped below 9,000. The variant, it seems that the portions they made up seem pretty much the same as the past few days. So are we now seeing a plateau in the caseload, or do you think the caseload is dropping? And are you expecting after the Mid-Autumn festivals there will be an increase in the number of cases? And also for quarantine hotels, people in the sector had said that the government has written to them asking them whether they would join the next round of quarantine scheme. Are you suggesting or expecting that maybe after November we cannot see a further easing of the quarantine rules from 3+4 to 0+7? Well, sorry, there's a 63-year-old male patient who was confirmed on September 9, and then through contact tracing, we found 2 other male patients aged 64. Altogether, 3 patients tested positive. As for the 91-year-old former resident at the residential care home, he was classified as a close contact. Therefore, he was sent to the Asia World Expo isolation facility. And on September 6th, he was sent to Tuen Mun Hospital A&E department. Back then, his condition was not bad. He had a fever, but his survival index was stable. And we found that his case might not be highly related to COVID because his CD value was quite high. But as I said, his heart problem deteriorated, and so we found that he might have the possible cause of death of a myocardial infarction. As for the trend in the past few days, the caseload seems to have come down a bit. Signs of a decrease in the total tally, but we still need to see over a longer period of time how things go, because there are 2 factors at stake. BA.5 variant, whether it has peaked. Now it makes up 60-something% of the total cases, and we will see whether the percentage will rise again. And also after the long holiday, will there be a rebound in the number of cases? We won't know till a few days later. As for the next round of quarantine scheme, As for the quarantine measures, I have nothing to add on that. Next question. Last row, gentleman on the left. I'm from Ming Pao. I'd like to ask HA about the beds. The number of people being hospitalized is about 2,600 to 2,800. Do you think that this is like a stable situation in terms of occupation of beds in hospitals? So are you not expecting the need to increase the number of beds available? And also for the provision of beds in Asia World Expo, Dr. Chong said that after Mid-Autumn Festival, more beds might have to be provided. What do you think of the need now? And what's the manpower situation there? And also for BA.4.5, are you suggesting or do you think that the rise in the spread of BA.4.5 in a number of cases, do you think there are more and more of such cases involving BA.4.5? In terms of beds, people receiving treatment at public hospitals has stabilized at about 2,000, late 2,000 to 3,000 in the past few days. But we are still at stage 3 of our plan. We cannot be complacent because experience tells us that the pandemic can fluctuate widely. So case numbers can go up and down sharply. And after the Mid-Autumn Festivals, we are worried that there might be a rebound. Therefore, we will maintain our flexibility. And as for provision of beds, we have said that we are now in stage 3 of our plan. We are prepared and we can increase the number of beds to up to 3,500 to 4,000 if needed. And as you may know, well, we have our community facilities as well, whether in Asia World Expo or North Atlanta Hospital, Hong Kong Infectious Disease Control Center, they can provide up to 1,000 beds. We'll try to we'll have those beds in reserve and use them whenever they're needed. As for Asia World Expo Center, we plan to add a number of beds there to add up to 280 beds in total. But it's worth making the plan and preparation because Asia World Expo now is dealing with elderly people mainly infected in the community. And looking at the figures in the past few days, the number is not coming down. If there is a stable decline in the number of such cases, and if, we'll see what to do. And also, there are 17 doctors and 88 nurses on duty there at Asia World Expo. Looking at the World Health Organization figures, globally speaking, BA.5, its proportion of cases is 86.8%. So in Hong Kong, whether our percentage of 66+% in terms of BA.5 cases, will it rise further? We don't know because nowhere else had the same situation as Hong Kong. We began with BA.2 in February, and now we had BA.5, the subvariant, as opposed to BA.2.2 earlier on in the year. So what percentage of cases would BA.5 make up? We don't know yet. Next one, lady in white on the right. In white, yeah.
Good afternoon, I'm from TVB. Now, you said earlier on that after the number has surpassed 10,000 each day, you would advise schools to close. Now, there are classes with smaller outbreaks. Would you advise further measures for schools, say longer suspension, or even switching to online teaching mode for some schools? Well, starting April, when we resumed in-person classes, we have been monitoring the situation in schools. Now we are adopting a more targeted approach. We will look at the distribution of cases in schools. For cases, while cases are increasing in the community, we require teachers and students to do an RIT before going to school. Now, the positive rate is similar to that in the community. However, there are activities in classes and schools, so we would look for clusters and conduct epidemiological investigation. If there are more cases in a certain class or a certain school, we would advise a certain class, a certain grade, or the entire school to suspend, plus the daily RAT test. We think it is effective in stopping outbreaks in schools. Let's take an English question. The lady in the middle.
CMP News. A few English questions. The first question is Finance Minister Paul Chan earlier said in his blog that Hong Kong could resume international travel if the COVID-19 vaccination rate is further boosted. But do you feel that this statement is realistic or actually provides any hope for Hong Kong residents when it comes to opening up? Because the vaccination rates for the first and second doses are already more than 90%, but yet the city is still not yet really opening up. My second question is on the CHP Red website. There is a change to the website that said that in the CHP website that said that people can report a RAT positive case in the website. But now the wording has changed from can report to have to report. So is the government going to make the reporting of RAT positive cases compulsory by law? My last question is on children. Basically, the suicide rate for children under the age of 15 has hit higher, with more people younger people taking their lives. And experts have said that these have been caused by learning disruptions during the COVID-19 pandemic. So is the government going to do anything to address this? Thank you.
You have three questions. The first question and the third question are both expert opinions. We respect the opinions of the experts, but I have no comments on these statements. For the second question, I think we would like to encourage all people in the territory, if they test positive by RAT, they report to us. But this is not yet compulsory by law at the moment. We would like the people to report. So we don't want them to feel that this is an optional.
下一位，右手邊最遠嗰位男士。
係有線新聞嘅。
I'm from cable news. So there is a survey saying that the suicidal rate for those under 15 is at a record high. Now, do you think the current anti-epidemic measures would affect the mental health of students? Well, when we advise suspension of schools, we target classes with clusters. We would advise those classes to suspend for 1 week. If we are unable to cut the transmission link or transmission chain, then there will be a lot of cases in the class and the school. It would be harder for people to come back to school because there are more people sick. So this is the end of today's press briefing. Thank you. Sorry, the speaker is not coming through the mic. Well, we don't have a conclusion. Now, for elderly people and the admission number through A&E is stable. Now, for elderly people who are not fully vaccinated or where the home environment is not suitable for isolation, the admission number is stable, is similar. For those patients, we think it is more appropriate to care for them as the AWE. So I think the AWE is still serving its purpose.